So our discussion today will be on epilepsy and the seizure disorders. The definition of seizure disorders is a situation where we have abnormal electrical conditions in the brain leading to abnormal movements of the body. So there are stages that occur for a seizure to manifest. Usually we have, for patients who have seizures, they have what we call a prodromal stage, whereby the patient feels that the seizure is about to occur because of some experiences they have. And this begin to appear way before the seizure itself manifests. So they may have depression, they may have anger, they may have sleepiness, they may have anxiety. And it occurs at the beginning of the seizure. So they may have altered visual and hearing sensations. There is also, they may have a weird taste or smell, they may feel dizzy, and they may also be in situations where they are unable to speak. So when we talk about epilepsy, epilepsy is a condition in which there is a recurrency in seizures. Usually if you have been having frequent seizures, then that is the state where you are diagnosed to have epilepsy. A seizure might just be a one-time occurrence which does not repeat itself at any other time. Then after the prodromal stage, we have now the occurrence of the seizure itself, and this lasts usually more than between 1 to 3 minutes. Then if the seizure lasts more than 5 minutes, then we have what we call status epilepticus, and this is usually a life-threatening condition. After the seizure, then the patient goes into what we call post-ictus state, and the patients are very tired, they are sleepy, they may be confused, and they may also suffer from injuries from the seizure. There are various types of seizures. This is what we call generalized seizures, which can be tonic-clonic, the most common, where there is loss of consciousness and there is body stiffness, and there is clonic jerky movements of the extremities with the abnormal movements of the face, the tongue, and this can lead to patients biting themselves. We also have focal partial seizures, where there is abnormal movement but the whole body is not involved, and the patient is not, they do not sustain a loss of consciousness. So they may have abnormal behaviors, but loss of consciousness is not there. You may just find common in children. A child may just be staring and may not be moving, may not respond to you. And when you see that, think about absent seizures. So there are some triggers to seizures, and some of them include stress. Any form of stress, could be environmental, could be emotional, could be psychological. Then you have trauma, which is any injury to any part of the body. If the patient becomes overexcited for any reason, sometimes pregnancy, loss of sleep, if the patient is not having adequate sleep. We have electrolyte imbalance, illness, any form of illness. We have abnormal visualization, if there is like watching a television which is blinking, which is has abnormal movement. Then if the patients are not taking adequate medications, or the medications prescribed to them are not adequate. We have use of recreational drugs like alcohol, other drugs of abuse. These ones can lead to abnormal seizures. There are other things that can cause someone to have seizures, which include blood vessel problems. You can have a bleed, like a subarachnoid hemorrhage. You can have acute ischemia of the brain, what we call cardiovascular accidents. Patients with hypertension, if the blood pressure is uncontrolled. And also, if you are exposed to anoxic brain conditions like inadequate oxygen supply. Then you have infections like meningitis, we have encephalitis, and even brain abscesses. Those can cause someone to have seizures. We have traumatic causes where we have epidural hematoma, that is a bleed in the brain, or subdural hematoma. Some autoimmune diseases like lupus, cancerous situations. We have metabolic conditions which could be diffuse. You have hypoglycemia or hyperglycemia. Sodium abnormality, where you have low sodium or high sodium. Calcium problems, if you have hypocalcemia. Low magnesium levels, low phosphate levels, thiamine deficiency. We have uremic syndrome, liver disease, and even hyperthyroidism. There are patients who have seizures, but there is no obvious cause, what we call idiopathic. After all the investigations, there is nothing that is found to cause the seizures. Then you have cancers or tumors in the brain. You can have like meningioma, and also metastasis to the brain, which is cancers from elsewhere implanting themselves in the brain. Then we have talks about drugs, which is what the major is alcohol withdrawal or excessive alcohol use. Some drugs of recreation like cocaine, they can lead to seizure disorders. So when you're evaluating a patient with seizures, you need to investigate some of these. Then there's also pregnancy, where we have patients with high blood pressure, they have proteinuria, and then they may have seizures, a condition we call eclampsia. So that may present as epilepsy. So how do you make a diagnosis of seizure disorders, and how do you investigate a patient who presents with a seizure? The first thing is to do either a brain CT scan or an MRI, so that you try to rule out the possibilities of tumors in the brain. Then a complete blood count to rule out infections. We have electrolytes, where you do sodium, potassium, magnesium, phosphate, and they also you do urea, because uremia is one of the causes of seizure disorders. Then you may also want to rule out pregnancy, especially in late pregnancy. They may present with seizure disorders. So how do we take care of patients with seizures? The first condition is you need to assess the patient and make sure that the patient is safe. So you need to be sure that they have an open airway, and also their circulation is okay, and their breathing is okay. So it's good always not to put anything in the patient's mouth, because if you try to put things in the mouth, then you may lead to compromising the patient's breathing. So make the patients lie in what we call the left lateral position. Do not hold them, just support them, and be there to avoid that they don't get injuries. And also you can give them oxygen, have an IV line, and make sure that they are well supported. Then there is the use of anticonvulsants, and usually the convulsants are indicated if the seizure either repeats itself after the first seizure, or the seizure is continuous beyond 5 minutes. Then you can give the patients the drugs. Then you may need to remove all restrictive clothing, and also time the seizure. Then you also need to educate the patients on the triggers and how they can avoid them. And also there is the need to stress to the patient on the need to take their medications. There are various types and classes of seizure medications which are used. There are those ones that can be given IV, and there are those that are given long term. And the patients need to realize that they need to consistently take their medications so that they avoid the recurrence of seizures. So thank you very much for listening to me. I request you that you subscribe to our YouTube channel, so that you get more educative health talks to be able to take care of your health. Thank you.